Thank you for visiting the Canadian Food Safety Alliance video online today. The Canadian Food Safety Alliance is a loose affiliation of hundreds of Canadians who are concerned about the public health implications of exposure to E. Coli O157. Our supporters range from produce growers who are very concerned about the risks to their business from E. coli contamination in the soil or groundwater to individuals who have been impacted by the devastating health effects of E. coli contamination. The good news is there is something we can do today to mitigate the impacts of E. coli. Many people are not aware, but E. coli O157, the most devastating strain of the E. coli virus, comes predominantly from cattle. In fact, science has shown that proximity to cattle ranches increases the likelihood of health-related effects from E. coli. Canada has today the only licensed E. coli vaccine in the world for cattle that can significantly reduce the shedding of E. coli into the environment. The Food Safety Alliance believes that a vaccine program designed to intervene on the farm at the source of E. coli can have a tremendous impact on reducing health-related impacts from E. coli. But don't take my word for it. We've assembled some of the top experts in the country on this video to explain some of the science behind E. coli and how we can effectively fight back against this dangerous pathogen. You'll hear from our experts on how E. coli O157 can have devastating long-term health effects on a person and how illnesses from this pathogen are costing our healthcare system over $200 million per year in long-term healthcare costs. You'll also hear from our experts on the science of E. coli and why it is such a virulent pathogen and remains a threat today despite industry efforts to prevent it from getting into our food. And finally, you'll hear from our experts about a vaccine that targets E. coli and can have a tremendous effect on reducing shedding of E. coli into the environment, particularly on so-called super shedders. We hope you find the panel of experts informative and helpful. We also encourage you to visit our website at www.canadianfoodsafetyalliance.ca, where you can register your support for our ongoing effort to eradicate this deadly pathogen.
Hello, my name is Dr. Guilbault, and I will be interviewing a diverse group of experts about fighting E. coli, specifically E. coli O157. This panel has been assembled to discuss the risk of human illness due to E. coli O157. The information you will hear supports an innovative approach to reduce this risk and also reduce the significant healthcare costs associated with illness due to E. coli O157. For the benefit of those viewing this video, I would like to explain that there are many strains of E. coli which occur naturally in people and animals that are not harmful. However, a small number of disease-causing E. coli exist which excrete a lethal toxin called virotoxin or Shiga-like toxin. Of all the virotoxigenic E. coli strains, E. coli O157 is most commonly associated with severe human illness in Canada. Bacteria are always evolving, and this strain has been recognized as causing human illness for the last 20 to 30 years. It was E. coli O157 that caused the devastating illness associated with contaminated well water in Waterton in 2000, the widely publicized $2 billion spinach recall in 2006, and most recently, Canada's largest recall of beef from XL Food in 2012. Independent of whether people are exposed through water, produce, or beef, what needs to be understood is that cattle are the primary source of E. coli O157. Our three panelists today are Dr. Jeff Wilson, who is an adjunct associate professor of foodborne disease epidemiology at the University of Guelph and president of Novometrics Research. Dr. Wilson has been involved in research, surveillance, and outbreaks investigation on E. coli O157 since the 1980s. Dr. Paul Sockett, now retired, is an expert in foodborne disease and the former director of the Foodborne, Waterborne, and Zoonotic Infections Division of the Public Health Agency of Canada. Dr. Sockett has studied the epidemiology of foodborne illness and has researched the cause and economic burden of foodborne disease for more than 30 years in both the UK and Canada. Mr. John Vieira, who holds a degree in economics and is a founding partner at Strategic Research Associate. Mr. John Vieira, who holds a degree in economics and is a founding partner at Strategic Research Associate. Mr. Vieira has more than 20 years experience leading market research studies. I would like to start with Dr. Wilson, who prior to the Walkerton disaster was involved in research in Ontario that made the connection between cattle densities and human VTEC illness. Can you comment on why there is a relationship between cattle and human illness?
Yeah, thanks, Louis. And yeah, as you mentioned, to understand the relationship between cattle and human illness, it helps to know a little bit about the biology of E. coli in general. E. coli are normal inhabitants of the intestinal tract of animals and people, and most of them, as you mentioned, cause no problem at all. In fact, they're necessary for normal digestion. But there are a few strains that cause disease in some species, and O157 is one of these. In cattle, O157 doesn't cause any problem at all. So in Canada, something like 10 to 30 or maybe 40% of cattle carry O157 in their intestinal tract. It doesn't cause any diarrhea. In fact, you wouldn't be able to tell cattle infected from those that aren't if you were to visit them on a farm. But those same E. coli O157 in those cattle, when people are infected, they can cause serious disease, and that disease ranges from bloody diarrhea to a condition called hemolytic uremic syndrome, which is the #1 cause of kidney failure in kids in North America, and it can be fatal. So cattle are the reservoir for O157. They shed the organism in their manure, and people become infected when they ingest those O157 E. coli from cattle manure.
Is the majority of cattle infected by E. coli, or just a few?
It depends on what test you use to determine if they're infected. It only takes a very small number of organisms to cause infection in people. If you use very sensitive tests, you'll find that over 50% of cattle are infected. If you use less sensitive tests, it ranges sort of in the 10% range. But many, many cattle in Ontario and in Canada carry the organism.
How is it linked to human illness?
Well, as I said, people become infected when they ingest O157 E. coli that comes from cattle manure. So you might wonder, well, how would that happen? A very common way that people become infected is on farms where there are cattle. So cattle, as I said, are shedding the organism into the environment. It's on their hides. It gets onto surfaces in the farm environment, like doors and handles and that sort of thing. And so when farmers touch those surfaces, and then if they don't wash their hands completely and eat something, then O157 E. coli can get transferred to their hands and they can ingest it. And of course, kids playing in the environment, touch cattle and so on, and then bring their hands to their mouth, and they can become infected in that way. So that's common, and is increasing in importance as other sources of E. coli O157, like contaminated hamburger, become less of an issue as effective control measures are instituted in abattoirs. Another way on farms that people can become infected is from drinking contaminated well water. So manure in the farm environment after a rain can drain into farm wells, especially some of these older hand-dug wells that are common across the country. And when the water becomes contaminated, of course, people, when they drink it, they can become infected.
Are all these illnesses, grabbing media attention, or what proportion of illness is grabbing media attention?
Well, most media attention tends to focus on outbreaks, and we've seen a number of those over the years. The Walkerton outbreak was particularly notable, and then recently the beef contamination in the XL Foods issue got a lot of media attention. But in fact, most cases are sporadic. That is, they occur in one person or in small groups, like family groups and that sort of thing. So the majority are sporadic, but they don't tend to gain as much media attention. For people working in public health, of course, they're one of the main concerns because they constitute the majority of infections.
Now I would like to turn to Dr. Sockett, and I understand that you and your colleagues applied the findings of the Walkerton long-term health study to calculate the ongoing cost of illness associated with VTEC infection in Canada. Can you tell us more about both the cost of the initial infection as well as the long-term healthcare cost?
Yeah, thank you, Louis. As with any study of this type, there are actually a number of areas of costs that we could have looked at. including cost to government, cost to industry, cost to society, as well as even personal costs. And in this study, we decided that we would focus on healthcare costs and lost productivity costs as the best indicator of the impact of VTEC infection on society. And to do this, we actually faced two really major challenges. One was to try and figure out the actual number of cases that occur in Canada each year of VTEC infection. And secondly, to try and figure out the length and severity of illness and how many people suffered the more severe consequences of VTEC infection. We know, for example, that VTEC symptoms vary quite widely in terms of severity, from very mild, almost inapparent illness, as Jeff has already mentioned, through to very severe outcomes, including bloody diarrhea and hemorrhagic colitis. We also know from studies that have been done, not just in Canada, but in other countries around the world, that hemorrhagic colitis in about 7% of cases can lead to a severe condition called hemolytic uremic syndrome. And many of the children or the cases that developed hemolytic uremic syndrome can go on to develop acute or even long-term renal failure. In fact,
when this strain of E. coli infects humans, especially children and the elderly, it can be fatal.
The under 5, but also elderly people and people with damaged immune systems. So we had to try and take that into consideration as well. As a result of these studies, we were able to get some idea of how many people suffered these severe consequences and to give some estimates to the costs of these particular cases. And the bottom line is that in any one year, acute illness, that's people who are getting ill directly and immediately as a result of exposure to this illness, total somewhere in the region of about $27 million, counting both the healthcare costs and the lost productivity costs related to illness, severe illness, people taking time off work because of that or to look after relatives. We also then went on to look at the ongoing costs of the long-term effects of E. coli infection. One of the things that we know about E. coli O157 or VTEC infection is that a number of people go on to develop severe sequelae to their illness or severe long-term outcomes. And we wanted to get some idea of how many people in any particular year are suffering from these severe outcomes. Again, we did some investigations, and as a result of those, we identified approximately just under 38,000 people a year experiencing these severe outcomes. When we looked at the healthcare and lost productivity costs, these amounted to somewhere in the region of $377 million a year. So we're looking at costs from VTEC infection per year in all ages of approximately $400 million.
But Paul, these numbers, it seems huge. You know, have you based these on the worst case? Is that the highest possible incidence rate that you considered, or?
Yeah, the numbers do seem high, but in fact, the calculations that and the estimates that resulted from those calculations are really very conservative and compare very well with the costs reported on this disease by researchers both in Canada and in other countries. In fact, the approach that we took to our calculations was to develop ranges of costs for different components of the illness, severity, and numbers. We did this to take into account both some of the uncertainties about actual case numbers and the varying severity of illness. And then we used either the mid-range or the lowest estimate that we had available to us to produce our final totals. And since we only focused our study on healthcare costs and lost productivity costs, we know that we are actually underestimating the actual costs of VTEC infection. For example, we know, for example, that we didn't include things like out-of-pocket expenses for individual patients on the one hand, right the way through to cost to industry and government, which again we didn't include in this particular study. So as I say, we are pretty confident that the costs that we're estimating are on the conservative end.
On the conservative end. I'd like to switch to Mr. Vieira. Your organization has expertise in the conduct of market research within specific agricultural sectors and within Canada. We know that Canada is the first country in the world to license an E. coli 157 vaccine for use in cattle to reduce shedding, which would reduce environmental contamination and the risk of human exposure. When you surveyed beef and dairy cattlemen across the country about the vaccine, what did you find, John?
Well, Louis, some good news here. Cattlemen that we surveyed, and this was quite an extensive survey across Canada with both dairy producers, feedlot, and cow-calf producers throughout the country, and they generally felt that they should be doing something on farm to control E. coli. So the methods as to how that is done and the costs associated with an immunization program are obviously details that we also explored, but the general thrust of the research and the general information that we found was that cattlemen are prepared to do something on farm. And one of the reasons they're prepared to do something on farm is that they understand that there's a risk to the industry as a whole, and that's exemplified by the Excel Foods recall that happened last year. One of the surveys that we did occurred about 2 or 3 months after the Excel Foods recall, so it was still quite fresh in their minds. And over 3/4 of the beef producers that we surveyed indicated that they felt that the recall had a major impact on their industry, and the impact was felt in lower prices or border issues in terms of exporting cattle or moving cattle around the country. So those are serious issues that were impacting the industry, and producers told us that they were concerned about that.
Okay, so they really feel that they should be doing something, but are they willing to pay for the vaccine?
These market research studies are valuable in the sense that not only do they capture the interest and the awareness of E. coli vaccination, but we also ask the hard questions, which in this case was, are you willing to pay for these programs, and if so, what are the kinds of things that you're prepared to do? And what we found was that generally producers are not willing to pay directly for the vaccine for obvious reasons. The E. coli in itself has no ill effect on cattle. It's naturally occurring. And further to that, if they do vaccinate their cattle against E. coli, they have no way of recouping their cost, because they're selling their beef at the market price, and the market price is determined by other factors. So willingness to do something, the cost recovery issue is one that they felt would need an external set of stakeholders to push through the process.
And what the government should, what would the government be involved in that thing? Or
well, we asked producers to tell us which stakeholders they thought would be most likely to be able to fund this vaccination program, and producers mostly felt that the government should bear the cost of on-farm controls, and one of the reasons for that is that it is a way to reduce a public health risk. So public health risk, public funding of the program. Now, the great thing is that producers are quite willing to do the work that's required to vaccinate the cattle, but again, the cost of the vaccine itself is something that they would like underwritten by the government. So again, to summarize, cattle owners indicate that they would be pleased to incorporate vaccination against E. coli O157 if the vaccine was provided to them at no cost.
Jeff, is the risk of illness due to E. coli 157 still an issue? Rural drinking water systems are better now than they were 13 years ago when Walkerton happened. Beef processing plant procedures and produce handling system have improved. Is there any data to support that the risk of human infection is still present?
Yeah, well, fortunately, the risk of infection overall does seem to be declining in Canada, which is good news. We know, though, it's obviously an issue, as exemplified by the XL beef crisis, and we believe that the reduction in rates of infection in people generally in Canada is probably the result, as I was saying before, of new procedures within plants, within abattoirs, within processing facilities, and so on, which are reducing the level of contamination. But this issue of on-farm infection, people picking up infection directly from cattle, or from the farm environment, or from well water on farms, that doesn't seem to be going down. And as a whole, its importance compared to other forms of infection with E. coli 157 is increasing. We've looked at, over a number of years, at risks of infection in rural versus urban areas in Canada in different provinces for 157, and going back to the 90s, we found in Ontario, for example, that the highest rates of infection were in rural areas, not in urban areas, and that there was a strong association between presence of cattle in an area and human infection. And that association hasn't gone away. In fact, it's been repeated in Ontario, it's been repeated in Atlantic Canada. Recently there was a study from France which showed a similar result, and most recently in Alberta we undertook a study looking at the rates of infection across the province. We found that the highest rates of infection with E. coli 157 were in the rural areas where there's a high cattle density, and there was a very strong association between 157 infection and kidney failure in rural areas with high cattle density. So that's not going away.
John, have you done any research on consumers' attitude toward vaccination of cattle as a means of risk reduction for humans?
Well, the studies that we've been doing have taken a multifaceted and multi-methodology approach. So we have done quantitative surveys with producers, but we've also done both quantitative and qualitative research with consumers in Ontario. And what we found is that the majority of consumers would like to see more done to reduce the risk of E. coli O157, and they are actually willing to pay a small premium for the beef they buy if they have an understanding that it has excellent food safety. So within the whole spectrum of local or regionally produced food, there is an expectation that it has a higher level of food safety than beef that may come from other countries around the world. And so if they know that their beef is produced in Ontario in this case, then they're certainly willing to pay a small premium to ensure that their food is safe.
Paul, John was bringing up a good point in reference to government involvement. Did your economic research yield adequate justification for government policymakers to support vaccination of cattle to reduce human illness due to E. coli 157?
I think the short answer to your question, Louis, has to be yes, and there's a couple of really good reasons for this. The first is the sheer size of the costs that we were estimating. As I mentioned earlier on, that the healthcare costs themselves, although they lost production costs, although they total about 400 million, the range is between 287 million and 600 million dollars per year for acute cases and the people with long-term outcomes of disease. If we actually project these costs forward for the next 5 to 10 years, they total up to between just under $2 and just over $3 billion for those periods. And we know that 60% of, or believe that 60% of human infections are in some way linked to cattle. So we would assume that something at around about 60% of those costs are directly linked to cattle themselves. We also know that we underestimated, probably considerably, the actual cost of these diseases. For example, we didn't include cost to government or industry from outbreak investigations, product recall and destruction, loss of consumer confidence in a particular product, the cost of public inquiries or litigation and compensation payouts, all of which we know can be very, very expensive to these various sectors. So the very size of these costs suggests that there's room for serious discussion with government about the potential costs and benefits of a concerted effort to reduce VTEC infection through reduction of E. coli O157 shedding in cattle. Whether or not this is through a vaccination campaign or vaccination together with other approaches that could be used to basically reduce human exposure. So that's one side of the equation. The other side of the equation is that we know that this is potentially a preventable illness in people. We know that a lot of people, as Jeff has said, the actual numbers of cases per year have been declining over the last 10 or 15 years, but nevertheless, a number of people are getting sick with this disease every year. We estimate somewhere in the region of 38,000 people in any one year are dealing with the long-term outcomes of this disease. And we know that it's potentially avoidable or at least preventable. And the conditions that people suffering from the long-term outcomes are experiencing, which may result in things like kidney dialysis and kidney transplant, for example. These conditions are painful, they're debilitating, they're costly, they are potentially fatal, and we see a number of deaths each year related to E. coli O157 infection. But the other thing is that they're potentially avoidable. And this, again, suggests to me that there is room for discussion about the ways to actually prevent VTEC infection.
So, in your opinion, would you say that the E. coli O157 is a public health issue?
Yes, I think the bottom line has to be that this is a public health issue. It's both a public health and an animal health issue, and this really speaks to the government's recent focus on what's called the One Health approach, which looks at both human illness and animal illness, where they intersect, and how by addressing one you can help prevent illness in the other. And I think also we need to remember that there are precedents for taking action at a national level to reduce diseases in cattle, which can also have impacts on human disease levels. For example, both tuberculosis and brucellosis are examples of this.
Well, I'd like to thank the panelists for your participation in this discussion regarding further E. coli O157 control to reduce a persistent and serious human health risk. It seems abundantly clear that we have a significant opportunity to reduce healthcare costs associated with VTEC illness by taking a One Health approach and addressing E. coli O157 at the source. Thank you.